Hello, Capital Advisors, Wealth Management, friends, family, and clients. I'm Tony Farina, and on behalf of our entire team here at Capital Advisors, we welcome you to our video on Medicare and Medicare planning. So one of the nice things about being in a new office space, which many of you have now visited, is we ended up with not just a nice new space, but nice new neighbors. And one of those neighbors is Rick McDermott with Senior Solutions, and they do Medicare planning. So we've been able to work with him. He's an expert on it, and it's been a really nice resource and relationship for us to be able to send people over and get these questions answered. This time of year, it's Medicare open enrollment season. This time of year, we get questions from clients. When do I need to sign up? If I'm under 65, what do I need to do in advance? What do I need to know? If I'm over 65 and still working, what do I do? If I'm over 65 and on Medicare, am I on the right plan? I see all these commercials for other plans. What's right for me? We do a lot of budgeting for the cost of Medicare and also the future. If you have a big expense, what's the out-of-pocket, and do I have enough? And so what we thought we'd do is bring Rick in and do a video and allow him to answer a lot of these questions that probably many of you are feeling right now. So with that, I introduce Rick McDermott with Senior Solutions Group. He's just across the road from our office on River Road, and they do Medicare planning. They've got a great website, and he's a great resource. So with that, Rick, thank you for joining us today.
Thank you, Tony. It's my pleasure. And yes, I really enjoyed working with Tony and the team at Capital Advisors, and we've got a great group of people doing a great job and a great service for our community. And love your new office. It's been fantastic, and I really appreciate the time to talk with people. This is the beginning of the Medicare annual election period, which starts October 15th and runs through December 7th. And in the months of October and November, we are having our Medicare 101 workshops, which are at 3:30 every Tuesday afternoon this month and all of November as well. So if you'd like to register or RSVP, you can contact us at 509-494-4288 or at our website at seniorsolutions.net. So I'm going to kind of just give you a quick overview of our process, how Medicare works. And this is our website here, seniorsolutions.net. And we have a link for those who need to enroll in Medicare. You can click Enroll in Medicare, and it'll take you through the steps to enroll in Medicare. Medicare frequently asked questions. And we also have our annual client workshop, which is coming up this coming week on the 12th of October at 10 a.m. You are welcome to join, even if you're not a client. We usually have most of the people that are on that will be clients or friends of clients. That'll be at 10 a.m. on October 12th, and we will go through any of the changes with Medicare. One of the local changes we're seeing is Bi-Mart is getting out of the pharmacy business, and they are transitioning all of their customers to Walgreens. So that's just a little tidbit of information for here locally in the Yakima area. We also have a tab where you can enter your prescription drugs to make sure you're on the correct drug plan for 2022. And also we have a Medicare Let's Get Started tab as well, just to kind of give you another overview of Medicare. So whenever people come to our office, or if we do a Zoom call with people, we usually start with the Enroll in Medicare tab. We don't assume that everyone knows how to enroll in Medicare. One of the nice things about being on Social Security before you turn 65, or if you apply before you're 65, more and more people are delaying Social Security, but for people that already have it, your Medicare card will come automatically and you don't need to enroll online. If you are turning 65 and you're not on Social Security, option one would be the best option to sign up for Medicare online through the Social Security website. So if you click on this tab here, it'll redirect you right to the Social Security website where you can sign up for Medicare benefits only. So Medicare benefits are always administered by Social Security, as the Social Security is kind of like the traffic cop, letting the traffic in to Medicare. So if you go to apply through Medicare, they will have you call Social Security to apply for Medicare. So just be aware of that. So if you want to apply for Medicare at age 65, that would be the best step to take to apply for Medicare online. You can call Social Security and they will schedule an appointment over the phone with you, as they're closed right now with COVID. But usually there's a month and a half or 2 month waiting period to schedule a phone appointment. So we always recommend the online version, and we're always able to help people. I was helping a gentleman just yesterday who felt like he wasn't able to go through it on his own online. We were able to help him get it set up as well. The other option.
How far in advance would you recommend someone getting started if they're not quite 65 yet?
So typically there's a 3-month build-up window. Good question, Tony. There's a 3-month window before your birthday month. So if you're born in January of 1957, your open enrollment window started the 1st of this month, October 1st. So you have all of October, all of November, all of December, January, your birthday month, and then you have a 3-month grace period after January, which goes through February, March, the end of March, then all the way through the end of April. So you have February, March, and April as your grace months. May 1, guess what?
Before your birthday and 3 months after your.
Yeah, on May 1, yes, on May 1. Now, if you're born on the 1st of the month, it starts a month early. So if you were born January 1, your initial enrollment period to sign up for Medicare would actually be September 1. That's the only exception to that rule. So about 1 in 30 people. And the other people that decide, you know what, I'm going to work another 5 years, maybe till I'm 70. That way I can max out my Social Security. You have option 2, where there is no penalty to delay your Medicare enrollment. So you can work as long as you want, maybe till you're 85. I've had a doctor here in Yakima work till he's 93. And you can work as long as you desire to work. As long as you have credible insurance through an employer, you can delay your Medicare Part A and or B. I usually recommend that you at least sign up for Part A, even if you're working, because that way you will have a Medicare number when you do add Part B later on, and it's easier. Because on this paper application, if you're past age 65 in 3 months, you'll need to download this form right here. And on that form, it's going to ask you for your Medicare number right here. So if you have Part A is free. There's no charge to enroll in Part A, which is hospital benefits. You could just put your Medicare number on there and we'll help you if you need help faxing it in to the local Yakima Social Security office on Fruitvale. I recommend using the local office because the hold times are a lot less than if you call the national Social Security 800 number. So that form will need to be faxed to Social Security, and you'll put your start date for Part B on the bottom of that one-page form. It's a very simple one-page application. In addition to that form, you will also need your employer to fill out their form, which is a verification of insurance benefits form. This is how you're able to delay your Medicare without a penalty, by having your employer fill out their page. We'll fax both of these forms in to the local Social Security office together, and then about 3 business days later, I advise you to call the local number, which we have on our website, the local Social Security office right here on Fruitvale. You click on that tab there, put in the zip code 98902, and there's the number you would call to verify that they received your application, the local Fruitvale office. Give it a couple days so they can get it in their system. And then you can verify that everything's in good order. I had a doctor here last week who's got laid off, and he didn't want to do any of this. And if you need help with it, we're here for you as far as applying for Medicare itself. Now, one caveat. I said I recommend everyone apply for at least Part A because it's free. If you're contributing to a health savings account, and you want to continue to contribute, do not apply for Part A and or B benefits, because you will no longer be able to contribute to your HSA once you enroll in Medicare A or Part B as well. So you need to be aware of that. That's really the only reason why I would not recommend someone at least sign up for the free Medicare Part A when they turn 65. Okay, so if you miss any of these deadlines, there may be late penalties. I had a gentleman come to our meeting yesterday, our workshop, and he missed the deadline, and he has to pay a 10% penalty on his Part B for the rest of his life. So the premium for Part B this year is $148.50 a month. So there's two main parts to Medicare. There's Part A and Part B. Part B has a premium, which is the $148.50. If your income is above a certain amount, you may pay extra for your Part B premium. So that's something to be aware of. So if you have an income above $88,000, there's a cost chart that the government provides. And here's the chart right here. So if you're single and your income's over $88,000, you may pay more than the standard rate for Medicare, which is the $148.50. And if you're married, and you're filing jointly, you would be in this second column here. So for some people that have higher incomes, they go back 2 years to look at your modified adjusted gross income, and it's called an IRMA charge, which stands for Income Related Monthly Adjustment Amount. This was set up in 2015. And so anyone who has a higher income above these amounts here may pay more for Part B, which is your outpatient care under Medicare, and your Part D, D as in drug, you would also pay a higher rate for your drug coverage as well if you elect prescription drug coverage. So that's something to be aware of for your Part B cost. I don't like to see people get those letters in the mail and they're totally caught off guard. Well, I thought it was $148 a month. How come they're charging me over $300? Well, it's based on your income 2 years back. Now, there is a hardship clause. You can fill out a form if you are laid off and your income has dropped dramatically. You may be able to get that waived. So that's Part A and Part B of Medicare as far as the cost goes. So Medicare Part B pays 80% of what Medicare approves of the charge. So if you go to a doctor in January of next year, you will have a deductible of at least $203. In 2021, the deductible is $203, and next year it's going to go up a little bit. We don't know how much yet. It might go up, let's say, $10 into 2022. So Medicare does not pay the initial $203 on your first visit of the year, whether it's an ER visit, an ambulance trip, lab work, or a doctor visit, et cetera, et cetera. You're responsible for the initial $203. After that, Medicare pays 80% of what they approve of the bill, but here's the catch. There's no cap on that 20% that you pay. So I had a client that had a heart transplant and a kidney transplant a couple years ago in Spokane, and fortunately, he didn't just have Medicare, he also had Medigap, also known as Medicare Supplement Insurance, to help with that $12 million bill. So there's two ways to go about this. If you have Medicare A and B, you need to decide if you need additional coverage, and there's two ways to get it. You can use option 1 or option 2, not both. You have to pick one or the other. So option 1 would be if you were to purchase a standalone Medicare supplement policy offered by private insurance companies. Each state has its own rules and regulations, but they have to meet the federal minimum standards. All of these plans are lettered, and these are the plans that are Medicare supplement plans, also known as Medigap. There's 10 plans to pick from. Nationwide, 47 out of 50 states have this lineup of plans. Michigan, Minnesota, and Massachusetts have their own standardized list of plans. But nationwide, all of these letters indicate which plan you've selected. So if you pick letter G, everything is going to be paid except for the $203 deductible. If you have letter F, That plan is no longer available for people new to Medicare as of January of 2020. Plan F and C are no longer offered, but you're grandfathered in if you are on Medicare prior to 2020. Plan F is the only plan, as well as Plan C, that pays the initial $203. I was asking that doctor that retired at age 93 this year what he would do to fix Medicare. This was about 10 years ago. He said, I would make people pay a little bit out of their pocket, and that's what the government did. As of 2020, you have to pay a minimum of $203 out of pocket if you're on Medicare A and B. There's no way around it anymore. Plan G will pay 100% after that, and you pay zero co-pays for the hospitals and for your doctor care or outpatient care. So Plan G, though, is also the most expensive plan, so you might want to consider comparing it to Plan N, which has a $20 office visit copay and a $50 ER visit copay as well. You can save up to $80 a month going with Plan N instead of Plan G. And if you're married, multiply that by 2, and that's a big savings as long as you're willing to pay a $20 copay when you go to the doctor, because your hospitals are going to be covered 100% on Plan N, just like it would on Plan G. So those are the Medicare supplement plans. They're standardized by law. So a Plan G is a Plan G, a Plan N is a Plan N. It doesn't matter which company you buy it from, but you can often save a decent amount of money shopping the plans from company to company. And in the state of Washington, you're allowed to change your Medicare supplement plan year-round. It doesn't have to be in the fall annual election period between October and December. As long as you provide proof of insurance, you can change to a different company. So usually what we'll do is we'll take a snapshot of your insurance ID card, send it to the new company, and by law in the state of Washington, they have to accept your new application, no health questions asked, no pre-existing conditions. It's a seamless transition, and that's a good way to save money shopping your plan, if maybe not every year, but every couple years, to make sure you're not overpaying. During this time frame, October 15th through December 7th, you can change your prescription plan. One of the companies named WellCare is reducing their plans from 6 plans offered down to 3 plans in 2022. By law, they're required to do this because they bought Aetna's book of business 2 years ago. They were allowed to keep 6 plans. Now that 2-year clause is running out, they have to reduce their plans from 6 down to 3. So one of the plans that they offer is $24 a month. It's going up to $65 a month in 2022. If you don't read your annual notice of change from your plan, you may miss that, and you may end up being stuck paying that $65 premium on your drug plan in 2022. So if you have a Medicare agent, have them review your plan. If you don't have a Medicare agent, or if your Medicare agent's never followed up with you, we're very, very willing to review your drug plan if you have questions about that. So that's option 1 under Medicare. Option 2 would be also known as Medicare Part C. And Medicare Part C has another term called Medicare Advantage. So on our website, we have a list of videos that you can check out, where we compare Medicare Advantage to Medicare Supplement plan, kind of the pros and cons of how it works. So with Medicare Advantage plans, you don't use your Medicare card, and a lot of people are probably seeing these endless commercials for Medicare Advantage on TV with Joe Namath, Jimmy Boom Boom Walker, and whoever else. Here's the latest one is Jimmy Walker. So they typically only are going to tell you about Medicare Advantage. They're not going to tell you both sides of the equation when it comes to Medicare. They're only going to focus on Medicare Advantage when you call those 800 numbers. Often those call centers, and check their stock prices for GoHealth, eHealth, they've plunged dramatically in the last year because of a lot of it's because of retention. They are losing members left and right because often they are put on plans that are not suitable for the person calling the 800 number. And so lots of complaints are coming in from these call centers. So be very, very careful when you see these ads on TV to call the 800 numbers. Often you might get a brand new agent that just got their insurance license and they've had 3 weeks of training, and now they're said, now go sell these Medicare Advantage plans by hook or by crook. So be very careful with those 800 numbers that you see on TV. So yeah, we have these videos where we discuss the Medicare Advantage plans on our website. You're welcome to check those out at seniorsolutions.net. And
Rick,
again,
just to clarify,
yes,
you represent both plans and multiple companies with both plans.
correct,
So,
correct. But we're not here to try to sell one or the other. We're here to educate and inform. One thing we never do is try to sell a plan to anyone. We want to make sure it's a good, suitable fit for your situation. And often that means coming, maybe if you want to come by our office or give us a call, we can look at your prescriptions, find out who your doctors are, find out what's important to you, because that's the bottom line. Because not everyone's the same. This is not a one-size-fits-all solution. Everyone's got a different situation and different needs, different concerns. Some people are willing to pay a low monthly premium and have more co-pays with Medicare Advantage. Because if you're on Medicare Advantage and you get cancer, you're going to pay 20% of the bill for your chemo and radiation treatment until you hit your maximum for the year, which could be up to $10,000 out of your pocket, depending on the plan you're on. Well, that's still a lot better than Medicare, which has no cap if you get cancer. Medicare Advantage has additional benefits that traditional Medicare doesn't have, like dental, vision, hearing. That might be something that would be attractive to you. Maybe a gym membership would be attractive to you as well, at no cost to you. So if you want to pay a lower premium and you don't mind co-pays, the Medicare Advantage option might be an option you might want to at least take a look at. If you're on a Medicare supplement plan, you might be very comfortable with that. You don't want to change it, that's great. You could leave it the way it is, but you might want to review your premium, because you can get the same exact plan, sometimes for a lot less money if you're a Washington resident. So a lot of people that are on Medicare supplement plans are very comfortable with them. They've had them, they work great. They don't have to worry about hospital bills. They can go to any doctor that accepts Medicare. The plan is guaranteed renewable for life. That means you can never be canceled except for non-payment of your premium, as opposed to the Medicare Advantage plans, which go on a year-to-year contract with Medicare. So in 5 years, the Medicare Advantage plan could say, you know what, we're losing money in Yakima County. We're going to pull out of Yakima County, and guess what? You're going to have to find a new plan. That is usually done in the fall open enrollment period, which we're coming into at the end of next week. So Medicare Advantage plans have their place. They're gaining steam. They're gaining traction nationwide. There's 5 or 6 new plans with one carrier coming into Yakima County next year. And this is going to be very confusing. They did a study about 10 years ago at a supermarket where there were about 25 different jams and jellies laid out on a table. And if you were to sample one of the strawberries or one of the raspberry jams or blackberries, they would give you a coupon for a discount on the jam. Well, when they had 25 to pick from, they found out that they didn't buy as many as the next day when they only had 5 jams to sample. People psychologically, when they have too many plans to pick from, often freeze up and they don't know what to do. So they did the same study the next day in the supermarket with 5 jams, and the sales went through the roof when they had 5 jams to pick from versus 25. So when we have 25 Medicare Advantage plans in Yakima County, like we will next year, it can be very confusing to try to sort through all that clutter. And what our job is just to really help you zero in on not having to waste days and days researching this, so you can maybe take a little bit amount of time to be able to figure out which plan is the most suitable plan for you. So that's kind of our process in a nutshell, Tony. Everyone's different. So just like all of your clients are different, you have different solutions for different clients. And we have similar processes, I imagine, as far as finding out which is the most suitable path to take. I think you would agree to that, correct?
absolutely.
So do you have any questions at all before we wrap up? Or
No, I think as everyone can see, it's very timely and relevant, being enrollment season and starting next week, as you said. So that was kind of the purpose of today, and the purpose of this video is to be able to put this information into our clients' hands with information that's needed, and So thank you, Rick, for joining us today, and thank you, Capital Advisor clients, for being a client, and hopefully this is value added.
Thank you, Tony.
Have a great day.